My name is Jill Bowen, CEO of Northwestern Medical Center and your host of the NMC Health Beat Show, dedicated to discussing hot healthcare topics. Today I'm talking to Sarah Nielsen, who has been a physical therapist at NMC for 17 years. Sarah has a unique insight about physical therapy at NMC because she's one of the few PTs with such a deep background that you may see her covering at several different sites. So thank you so much, Sarah, for being here with us today to talk about physical therapy.
It's my pleasure.
So you've been there for 17 years. So what does it take to become a physical therapist?
Well, the actual study of physical therapy has changed some over the years. I have a bachelor in science of physical therapy with an extensive background in human anatomy, human movement, physiology, pharmacology, kind of a general background in the medical studies. That has changed over the past few years, and most physical therapists coming out of school now actually have a doctorate in physical therapy.
Oh, wow.
So they're coming out with a DPT, and so you'll see a variety of backgrounds in our therapists at Northwestern as well as around the state.
Yeah, there's definitely a lot of specialties inside of that. So how would you, since we're going to be talking about physical therapy, how would you describe what is physical therapy?
So, like I said, physical therapists have a deep background in human anatomy and movement. So basically, our focus is how does somebody move and remain active and functional within their lives. So that varies depending on what your life entails and your stage in life. So whether you're an infant or a senior. But basically, we're really looking to maintain people's independence and their mobility and their function in their daily life.
Yeah, great. That's a lot.
It is a lot.
It's like, wow, that is a lot. So how would I know if I need physical therapy?
So basically, what I usually tell people is if you're having any issue with your body that's limiting your ability to perform your everyday activities, whether that's work activities, fun recreational activities, or just getting up and combing your hair and getting dressed in the morning. If you're having any issue whatsoever that's limiting that, that's related to your body, your musculoskeletal muscles, joints, how those things work together, then you could benefit from physical therapy.
So if I go to my doctor and they say, you need physical therapy, what do I do next?
Absolutely. What you're gonna. So if you go to your doctor and they recommend physical therapy, then they would give you a referral, either give it to you or send it directly to us. You could call our main office at 524-1064, which is in our St. Albans cobblestone setting, and our front office can set up an initial evaluation with a therapist. And they can set that up in any of our settings. We have sites in Georgia, in Cambridge, which is our newest site at the Cambridge Health Center. We have a site in Enosburg, and we also have an aquatic facility where we do our aquatic physical therapy here in St. Albans at Brandon's Pools.
Excellent.
So our front main office can set those appointments up at whichever location is most convenient for you, whether it's close to where you work or close to home.
So can you describe some of the therapies that are available?
Sure. One of the benefits of working at Northwestern Medical Center Physical Therapy Rehab Department is that we do have an extensive staff with a wide range of specialties, certifications in those specialties, and so it's nice because we can collaborate with different specialists within our department. We have therapists that treat lymphedema, which often occurs after injury or surgery, where the body isn't able to manage its swelling, and they can do treatments that are specific for that. We have therapists that specialize in vestibular issues, so that's balance, inner ear. A lot of people have issues with vertigo. You'll hear that a lot.
Oh, yes.
And we have therapists that are trained to treat that. That can be a pretty effective treatment very quickly. Often we see patients once, twice, and we've treated their vertigo and taught them how to self-treat that after.
Wow.
It's a pretty, it makes a big impact in their lives. If you've ever had vertigo, to have that be such a quick treatment really makes an impact in the way they're able to function, so it's exciting. We have therapists that focus on balance retraining, so whether you have a balance issue that's related to a musculoskeletal problem or whether it's related to a stroke, a head injury, a concussion, we have therapists that can treat that. We do incontinence therapy, both for men and women who have urinary incontinence. There are some techniques that our therapists use with exercise as well as biofeedback to help treat that. Again, something that can have a big impact on somebody's lives if they're having issues with incontinence. And we also have therapists that really focus on work rehabilitation. So if you've had an injury at work, we have therapists that are very focused on regaining your function to return you back to work. Again, sometimes that's a minor injury. We may see somebody for a couple visits. Other times it's pretty extensive, where people have had a surgery or a major injury, in which case they may come in and do some work rehabilitation, which involves very specific exercises that simulate the exact activity that person would be doing at work. And so that they're able to come in with the therapist, do those activities, be trained in how to do them safely, and then we're able to better assess if they truly are ready to go back to work. And again, that makes a big difference in somebody's lives if they've been out of work for months on end and then we've retrained them to get back to the activity that they were doing, which is pretty exciting. Recently, we actually started a cancer rehab program. So often after people have had cancer treatments, chemotherapy, radiation, their function has declined, they're not as active, their endurance has declined, and they meet with a therapist who one-on-one evaluates them and sets up a program for them, and then they're able to come in a few times a week and do that program to regain kind of their activity level, which is really nice.
Wow.
So there's a lot going on.
Boy, did we choose the right person. You know it so well. That's really terrific. So talk a little bit about scheduling, because there's people, we all work, or most do work, and so these busy schedules, how do you accommodate folks that may not have time for it?
Absolutely. So one of the ways we accommodate that is our different locations. So again, having those satellite clinics in Enosburg and in Cambridge and in Georgia allows people to kind of fit their schedule to what best meets their needs in terms of a location. We also have early morning appointments. We see patients as early as 6:30 in the morning. We have late afternoon, early evening appointments, so we're able to see people then. So we can basically, hopefully, work with your schedule in terms of time frame. The other thing we do a lot is we really work with the patient to come up with a plan that's going to work for both the problem that they have and for their lifestyle. So some people may be able to come in for therapy a couple times a week because they feel like if they're there and we're watching them and working with them, that they're going to be better at doing their exercise routine or the treatment that we've recommended. Other people will say, I'm really going to be good about doing exactly what you tell me to do, and can I come in every other week and check in with you and have you reassess where I'm at and make some changes to that, and we'll work with people to kind of make that work, and we really like to involve the patient in what we call that plan of care. So saying, this is what I'm recommending, but you tell me what do you think will work for you, and we can adjust that. It may not be as effective if we're seeing that person once, twice a month as it is if we're seeing them once or twice a week, but that's a choice, and we'll work with whatever the patient's able to commit to.
So once you get someone started on a therapy program, is this forever, or what do you recommend for someone that may have had an injury and so they're doing the therapy, but do you recommend some continuation of that because they have had an incident?
Right. So again, that's going to depend on their problem that they're presenting to us with, but quite often a lot of the education that we're doing with our patients is lifelong. So we do a lot of education about posture, about body mechanics, how to lift things, how to be safe, and how to move your body safely. So that absolutely is lifelong. That I would teach to anybody regardless of whether or not they had an injury. So that is stuff that we recommend to people to continue. And many of the injuries that we see, we do say to people, you've had back pain. chances are, you're going to have some degree of that back pain reoccur in your life.
Right.
There's been some good studies to show that once somebody's had a back injury, the reoccurrence rate is pretty high. So we'll tell people that, once we're done with your therapy, we may recommend that you do those exercises at home less frequently, or we may say, if you start to feel like this is coming back, you need to get right back on the wagon and start doing those exercises on a daily basis, so that hopefully you can prevent the need to come back to see us to work on a more formal basis, but you can do a lot of that on your own.
That's super. Do you do any group things? I remember at, I think it was in Georgia, there was some group activity for women. Are there any group types of things that help keep people well?
We are doing the cancer rehab program, which is a group.
Okay.
After the initial therapist sets up your program, then that is a group setting. We do offer some classes to the public. We offer a Tai Chi class, which is great for strengthening balance, mobility. That is going on right now on Monday evenings as a session, and we do a 6-week session of those classes typically, and then when we start a new session, we invite new members of the public to come join that. We've just started last evening actually a Pilates class in our Cambridge setting.
Oh, excellent.
Pilates works a lot on core strengthening, so that was a great addition to our program, and we're really looking to get out into the community and do some more of those kind of wellness classes to the general public. Our actual skilled physical therapy that we bill for through insurance companies, and we accept all insurances, that is done on a one-to-one basis. So it's really important that when you have physical therapy for an actual injury, that you're able to sit and be working with a therapist one-on-one to have that personal attention and personal care. So that's done one-on-one.
That's great. That's great. So for the young athlete, what do you recommend to parents to make sure that their children are getting ready for the sport in a healthy way, so the injuries don't start young?
Absolutely. So the biggest thing with young athletes, and I have a young athlete at home that I preach this to quite often, is if you show up for the first day of your preseason or your first practice and you haven't done that activity in months, then you really are putting yourself out there to injury from overuse, from the body not being used to that activity. So really doing some off-season training, even if it is at a lesser intensity, to get your body worked up for doing that activity is really important. Stretching is important, proper equipment is important, but really keeping yourself healthy and active in between seasons is very key to preventing injury. And proper training once you get into the season in terms of sport-specific exercises. One of the other services that NMC Rehab offers is that we contract out our athletic trainers to the high schools locally. So we do have an athletic trainer that is employed by NMC Rehab that works at both BFA St. Albans and Missisquoi Valley. So they're able to oversee a little more of the high school aged athletes to make sure that they're being safe and trained well.
So that's great that we have someone right there literally on the field or on the court.
Absolutely.
With folks, so that
and then if there is an injury and those athletes need treatment beyond on the court or on the field, then they're able to get referred into physical therapy or to see one of the orthopedic physicians.
So you've given advice for the young athlete. What about us, or at least me, that's a little bit older? Anything to help keep us strong? Really
doing some core exercises is key for the older athlete. I think a lot of people tend to work, especially when we see people in the gyms, they're working on their arms, they're working on their legs, those kind of things that give you the most bang for your buck when you look at the body. But really the core is the core, and that's where everything comes from. So working on making sure that you have good muscle balance in your core and flexibility, that's the other key that people sometimes overlook, is that flexibility and stretching.
Right. Excellent. You seem pretty passionate about your work. Tell me a little bit about kind of what gets you up. What do you enjoy the most about your work?
I would absolutely say that I have a fun job. So it's a lot of work, but it's definitely fun. And what's nice is that you get instant reward. So we're working with people who are having difficulty taking care of their grandkids, having difficulty playing the sport that they love, can't go to work, which has a huge impact on your life. And to see that the changes we make a difference in their lives immediately. So when somebody's able to go back to work or can, come in and tell us, oh, I was able to lift my grandson up for the first time today, or I got back on the field today, and they're so excited, it's certainly rewarding. Because we do tend to see our patients out through a process, it's nice because then I get to know my patients on a personal level, not only, for the 10 minutes that I might see them if I were working in a hospital setting. When we're working in the outpatient setting, we really get to know our patients on a personal level. We know what drives them. We know what they want to get back to. So it's nice to see that you're able to make that difference in their lives and see what happens when you've been successful.
Yeah. Wow. Well, our time has flown, but Sarah, thank you so much for being a wonderful guest on this show and helping us understand what is physical therapy, when you need it, how to access it, and a great overview of the different modalities that are available. So thank you so much.
Thank you.
This is Jill Bowen, CEO of Northwestern Medical Center and your host of the NMC Health Beat Show. And it's time to get out there and get fit, stay in shape, stay healthy.